Hi guys, welcome to Caapid Simplified. As you all know me, I'm Leena, your mentor in the US Dental Dream Path. And I have Arwa Hussain Chaiwala today from NYU College of Dentistry with us. And I'm going to actually try to unwind NYU School in the application process for you today. Hi Arwa, how are you?
Hi, Leena, and thank you giving me this opportunity to talk about NYU School of Dentistry and help people. And I really feel grateful to you and to Caapid Simplified to give me this opportunity. Thank you.
Thank you. Thank you so much for actually finding time and guide our applicants who will watch this video. So let's roll it. Can you start by telling a little bit about yourself? Like, where do you come from? Why did you choose US and why DDS?
So I come from India. I did my dental school from Government Dental School in Indore, Madhya Pradesh. And then I practiced for a while. I wanted to expand my career, but expand in a different direction. So first I did my master's in research, which was applied clinical research from the University of Minnesota. During that time, I started my dental school application, and I started giving my National Dental Boards Part 1, Part 2 TOEFL. And then I kind of like start applying in different schools. So I think it was like just a whole 36-degree circle where I started as a clinician, then I worked as a clinician, I did something research, and then again back to a student and then back to a clinician.
And between that, being a mother of 2 kids.
Yes, so I do have my family here. I live here with my 2 kids. I live with my daughter and I live with my son.
That's so beautiful. But tell me a little more about your experience and transition from the clinical practice to the research experience in US.
Research experience was very amazing because it was like more focused on medical device industry in Minnesota. My research was more focused on medical devices, which are implantable devices like pacemakers and defibrillators. And probably you will understand more about like the obstructive sleep apnea device,
Right.
which is used for the treatment of refractive obstructive sleep apnea. So those are neuromodulation devices. So basically I worked in the industry for like 3 years before coming into a dental school. So my focus was on those devices, their approvals, and how the clinical trials are run on these devices, and to gather some more evidences.
Wow.
So I was working now at the back side of the research. So I worked with Medtronic. It's a big name. I worked there as a clinical research associate for 3 years. Then I did something in preclinical as well because I never understood that how this whole clinical trial run. So I worked with Wuji uptake. So I did work for 6 months on animal studies, and then I joined the dental school.
Wow, that's so amazing. So how does it feel to come back to the clinical setup? Of course, I know it has changed the perspective you see patients now, because once we have more knowledge about evidence and how things work, I can only imagine how things change.
I think my perspective changed from like being a clinician to now being more focused on the kind of evidences what I have and how I use them. Probably I'm more focused on like following the protocols which we have. Like, for example, just let me give you a small example. If a person has got a knee surgery and he's perfectly okay, probably antibiotics are not indicated. Initially, if I'm a clinician, still I would fear and I would try to give some antibiotics. But when being in research and gathering that evidence has made me more confident in following that protocol.
Yeah.
So I think that has changed a lot. It changed the whole perspective.
That's so amazing. But why did you choose to come back to dental school after doing so much of research?
I came back because I was working as a researcher, but part-time I also got an opportunity to work with a community dental care clinic. It's a non-profit organization. So I was working as a clinical assistant there. There I felt that there is a gap. People need help. Especially after COVID, there was a lot of backlog of patients. And trust me, those non-profit organizations, they really need good dentists there so that that backlog could be cleared. So I thought that let us give it a chance and let us see what comes up. So I was fortunate enough, got accepted, and right now I'm in D3 at NYU School of Dentistry.
Congratulations, but that's so good. You actually got acceptance from Buffalo, and also from
Yes.
Minnesota. And you actually moved out of Minnesota and chose NYU college. So definitely there has to be something.
Yes, so actually, yeah, you are right, Lina. I got accepted in 3 dental schools and I got invited by 7 dental schools, waitlisted in 2. Uh, Minnesota, I was in Minnesota, and that thing like always put Minnesota Dental School on my top priority. And then Buffalo, I was crazy about Buffalo Bench because when I started my journey with preparing for Buffalo Bench because I kind of like had that idea that if I clear a bench exam, the school will take me, and that is true. So, and I applied NYU, and I was just waiting. So it was just, I think, by the grace of God, NYU came in and sent me an invite, and then I prepared harder for it, and then I got in. But yeah, I think NYU was my dream school because the way NYU presents itself is like huge. So yeah, that's it.
It's one of the top 10. So definitely it's huge.
Yes, it's huge.
So tell us a little more about your Caapid prep. Like, when did you start planning? When did you think, okay, now you're prepped to apply to the dental schools?
My first step towards Caapid was 2020. That was my first cycle when I applied. I was still new. And I was looking for the resources, and that's what I told you, Lina, that some of the lectures I did took from Caapid Simplified about the bench prep courses. And technically, I saw you first there only. And then after that, I was like, I have to take some hands-on experience, and I have to know how this whole
thing works.
Preparation of Caapid works.
Yeah.
For SOP, I think I was pre-prepared because I already had my SOP for St. Cloud State University. So I used that SOP as my backbone, and I tweaked something here and there. And when I presented that SOP to NYU or to dental school, I had to make some adjustments in terms of what kind of profile I'm trying to highlighting. So when I'm highlighting my profile as a dentist and then as a dental student, probably dental school will like it. Yeah. And when I have to apply to companies like Medtronic in research, then I will highlight the research aspect of me being in research. And I have like 5 publications out by now. So probably I think that is what I tweaked here and there, just changing the whole format of the SOP. For LOR, I write my own LOR because I think it's not important how accurate your LOR is. It is important how correctly your LOR reflects what you are trying to show them on your resume and on your SOP.
Right.
So it should be a well-written LOR, I would say, rather than a perfectly written LOR, because they are not looking for like medical writers or professional writers to write an LOR.
Right.
So it's always good if you write your own LOR. Just make sure that it's more grammatically correct and it doesn't have spelling errors. And if it's not like a super wow LOR, then also it's good. It's not super wow SOP, but if you have written it yourself and it reflects what you want to say, it's good. The other tip I would like to give is that your SOP and your resume should not be alike. So your SOP is your story and your resume is your achievements.
Right.
So you have to streamline your dream with your achievements.
And that is so good advice, because there are so many candidates I help with their SOP writing and their CV. So I know many people think CV writing is not a big deal, but it is, because there is a format, and you won't believe, in Buffalo we are actually getting classes on how to write a CV. So it is so important for them to actually clearly understand what your experience and achievements look like. But SOP is a completely different story. Like, that is more about your personality, your behavior, how you survive different battles, right? But people don't understand it. Even I didn't understand my first cycle.
I kind of like had an idea, but probably when I started this whole Caapid cycle, things were more clear to me. Yeah. Then about my bench prep course in my whole Caapid cycle, I would say it's always beneficial to have somebody guide you, because these schools have specific requirements and specific measurements. It's not about how great you prepare. It's about you should prepare according to their standards.
Right.
So knowing that standards and preparing towards that standard is more important. So this is kind of like what I did. I took like Buffalo bench prep course. Yes, because it kind of like gave me an idea that what Buffalo is specifically looking for, because every school is different and every school bench preparation is different.
Right.
So I think we really have to refine our hands. Secondly, as an international students, we don't have much practice on working on typodonts because tooths are very soft tooth.
Yeah.
So you really have to have that hand skills and that feel. So
Yeah.
I would say the earlier you start, the better.
Yeah, definitely. I second that. So during your journey, what was the most overwhelming part for you?
The most overwhelming part was writing question answers for each university. Because I applied the supplemental. Because till Caapid it was all okay. I was writing everything. But the moment you start applying to like 20 universities, now you have more than 50 questions to answer, and they all are different.
Right.
So you have to take out some time. You have to focus on that particular university, and then you, again, as I said, what you are writing should match with what you are telling them in your SOP and CV.
Right. And that is so beautiful. Even especially, I really like I've been knowing you from more than a year now, but I know how you focus on each school, like how you told me about Buffalo. So you started with one school, you inquired everything about that school, you tried to achieve something there, and then you moved to second school. So that is very important. I know we are short of time, but of course you have our help. Caapid Simplified have all these files where they have written everything. But even then you need to do your own investigation to understand each school personally, and that's what I think each school wants.
Because that's what is needed. In US, every school is different and every school requirement is different. So if you are applying to NYU, you have to have some knowledge and background what NYU is all about.
Right.
If you are applying to Buffalo, you have to have that knowledge. If you are applying to Minnesota, you have to know what Minnesota is looking for.
Yeah. Exactly.
And then how you could be a best fit, rather than applying blindly to each and every school, and rather having the same format of your supplemental answers for each school. So I would always suggest that take out some time, because these people are very serious about their writing stuff. They sit and they read, trust me. They sit and they read. They know what you have written. So that is my only advice, that sit and write. But of course, if you don't, then do take help of the people around you. Have them proofread like as many times as they can, and then you can come with a final version before you submit your final questions and answers to those schools. Right. I think that would be super helpful because they do read.
Yeah. And you told me that the NYU school interview is closed file, right? So many applicants actually think if it's closed file, they can, speak whatever they want. But tell them that most of the schools actually match later your application and your interview. How did it go?
Yes. So of course, every school is different. NYU is closed file. It means that if they don't open your resume and they don't start asking questions from you from their resume, probably what they are looking in their candidate is that how better you can work in a team and how better you can work in a big environment, in a huge environment like NYU. It's a bigger batch.
Yes.
So how focused, how streamlined you are in your thoughts, so that you can be a best fit for NYU.
Definitely.
So in my interview process, let me tell you that they were very specific about their timings. They usually give like 10 minutes and they explain everything about their school. And then the rest 20 minutes is yours, where they initially starts and makes you comfortable asking by yourself, tell me about yourself and what you have done. Then for me, they did ask me one ethical question. So I think it's just to understand who you are as a person and how much you know about NYU. As I said before also, that they want to know that do you know how NYU looks like? Do you know what is living like in a New York City? How diverse it is? Right. And how the city is fast paced, and of course living in New York is expensive. So probably they also try to understand your overall personality. If you are more extrovert and if you are ready to adjust anywhere, probably this is a good place for you. But if you are a little bit slow paced individual, then I would suggest that first come to NYU, first come to New York City, have a feel, and then start like applying to the schools, like NYU School of Dentistry.
Yeah. So as you told me that everyone wants to know why NYU, right? And you did your research. So there is no person better than you who can tell us the special aspects of NYU. So why NYU?
Of course, that's like NYU was my dream school from the time when I was applying to the Caapid applications. The reason being, it's very beautifully represent itself on its website. A school is very detailed when you go to the NYU website. So I think that was huge for me. And secondly, NYU is like very diverse in its patient population and in its overall student population, I would say. So it makes you more comfortable. So that was huge for NYU. And of course, in technology, NYU is very far ahead in its game. I would say we have all latest things in our school. Right now, we have like Yomi robot, which is available to DDS students. So it's a beautiful technique to place implants, and I enjoy it a lot. You have to find your patient, and then you have to go to the faculty. You have to follow the protocol, and then you can use the technology for the implant placement. Trust me, it's amazing. Apart from that, we also have like artificial intelligence incorporated in our curriculum. So it's very beautiful. Like you wear that headset and then you can see technically everything when you are trying to give an inferior alveolar nerve block. So it was again new for me.
Yeah.
And apart from that, NYU has a lot more to offer in terms of its honors and elective programs. Right now we have our new center in Brooklyn, which is like a highly clinically focused elective program for students. And it accepts like 70 repeat students, where you can go an additional day and practice a lot more on patients from morning 8 till 6 in the evening. And there is no limit. I mean, you can do as much as you want.
Yeah.
So I think that way it's very beautiful school. And the third most important aspect is research. We have our own research mentors, and we can find one. It's called Bluestone Corner Research. Apart from that, if you are doing good in your DDS curriculum, we have a program called DARE program, where you can enroll either in 1 credit research program. I'm enrolled in DARE, so I have done my 2 credit course in DARE as a D2 and as a D3, where you find your own mentor and you do your independent research. So kind of like it's very beautifully
designed.
Design or incorporated, I would say, in the curriculum, that you don't find scarcity of anything in NYU.
Yeah.
And in terms of material also, oh my God, you have ample of everything everywhere. So you don't feel that you are anything less than anybody else. Like it's really amazing. NYU is like NYU.
I can see that in your eyes. But also,
I just love NYU.
Yeah, right? Like everyone loves NYU once they are in NYU. I know about that. It has got some fascination.
Some fascination, yeah.
But also tell me about how many people were there with you when you were giving interview. Like, is it very competitive? How many do they invite? How does that work?
I think NYU is very focused school. I would say for 29 seats, probably they invite 100 or 110 people. It's 3 batches of interview, very straightforward. And probably they start interviewing people in August, and by the end of September or first week of October, the results are out.
Yeah.
I wanted since it's such a focused school that it really invites a limited number of people on the basis of your interview, your CV, and most importantly, NYU has its own supplemental questions. Probably those are some of the main keys from where they select students. Of course, as every other school, your GPA and TOEFL matter, because NYU has a standard score of 100, below which you can't apply to the school. So that matters a lot. So you should be having a good TOEFL and good GPA, but that's not the only thing NYU is looking for. If you have some good research experience, it's always cherry on the top. And I think that's what about it is. Our class is very diverse. So we have some young graduates. We have some more practice and refined clinicians like me who are like 10 years in the practice and then apply to dental school. And diversity wise also, we have students from every part of the country. So I think it's a very mixed batch.
That is nice. And do you integrate with the regular batch?
Yes, we do integrate with. Initially, when we joined, we are working as an advanced standing group. But once D3 starts, we are integrated with normal D3 class.
Same as Buffalo. That's nice. And how is the patient pool? How is your experience so far?
Patient pool is amazing. And you get a lot of hands-on experience on patient. We work in our own group director practice. So technically we see 6 patients or 7 patients a day, which is a lot. And it's a requirement of the school. So if you have anything below less, your director will come and will ask you to have more patients schedule, so that you can have like more hands-on experience. So I would say it's just amazing and very nice. So overall, we in a week probably we see 14 to 15 patients depending upon when we are scheduled.
Yeah, and that is D3. How about D4? Will you increase your patient pool in D4?
D4, of course, yes, because then we get one more additional day in the school to spend. So again, in that day, you technically see more than 5 to 6 patients a day. So it, of course, gives you a more experience on patients, like more hands-on experience on patients.
I agree. Which resonates with the clinical practice, because that is how generally a dental clinic will see in a week.
And apart from that, I think NYU is the school which allows you to do molar endos. So on floor, we are allowed to do molar endos.
Buffalo also
so we can do. Okay.
I'm kidding. I know we both are endo people, so we'll always have our endo.
We always talk about endo, right?
Yeah, right.
So I think, and once the faculty understands that you know what you are doing, they are very comfortable giving you patients. So they will not discriminate. That they would say that you are an advanced standing student, so you can start with an endomolar. Like it's completely okay with them. They will never stop you for doing anything.
Yeah,
you should be confident doing what, and you should know what you are doing.
Right.
And they understand that. I think NYU faculty is the most flexible faculty we can have, because they're very respectful towards the student, and they acknowledge the fact that we come with a lot of experience and we know what we are doing. So they will always be very happy with us. Like
that's
in school we do share like student professor relationship, but they acknowledge that we are doctors. So they are very, very nice, very flexible.
Yeah, that acknowledgement is actually good, especially when you are surrounded by everyone you don't know. The culture is new, the food is new, the country is new. So definitely if we can connect through our previous experiences, that actually gives us an added advantage. Yeah. And how important is the research for any candidate who will apply to NYU?
As I said, my batch is very mixed. But what my statistics tells me is that for NYU, research plays a role, and it's important. And I don't think it's just for NYU. Any school, if you have research in your resume, it's always cherry on the top. It always shows that you have a tendency to collect evidences and you want to give back to the community in the form of a researcher, because anyhow, if you are working as a clinician, you are giving back to the community. But research is the backbone of everything, because it's the evidence, it's a kind of proof what you do. So NYU respects that a lot. And trust me, in all the webinars till now I have attended with NYU, they respect people who comes from a research background.
They do.
They give those people a lot more I would say importance and acknowledgement. And honestly, they don't care what kind of research you have done. It could be like a basic research, clinical research, translatory research, preclinical, clinical, animal research, anything which you have.
Yeah, they, as you said, that they just want to understand, because what I have seen, even in the regular students from D1, they are very much involved in research, if I speak about Buffalo. So when I come from the clinical practice, I don't know anything about research. So it's a good learning curve, even in the dental schools for regular students. So if you have research as an international, of course, they are going to prefer that. That's nice. So, like, where do you see yourself after 5 years, I would say? I know you want to give back to community. I know you are a researcher. You are a mom. You are so patient. You love endo. So, do you plan to do residency or do you want to practice right away?
Right now, I have my family and I am an international student. So my priority is to get my DDS degree done and my licensing done. And then I would for sure looking for jobs which where I can start practicing. Like I can get rid of my loans and my other stuff. So that would be my priority. Residency, I'm not thinking right now about residency. I think I would.
We'll go together, okay, Arwa? We'll
Sure, I mean,
match mates. You have already ditched me in Buffalo. Now I don't want
No, I'm not going to ditch you, Lina. You are an amazing person. So trust me on that. We would be applying together when we are applying.
Yeah, let's do it.
Yes, let's do it.
Okay, that's so amazing. It was so good to hear your research experience, especially because I don't meet many people who have research experience, especially in US. So thank you so much for sharing so much about your journey. If I ask you about the last advice that you would want to give our viewers, what would that be?
As I said repeatedly in my whole interviewing process, that guys do pay attention to your SOP and LOR and your CV and your supplemental answers. Trust me, they read it. They read it so in a such a detailed way that they technically know everything what you have done, and don't use GChat or something like that. Don't They know that and they will tell you. So just try to be as honest as you can. It doesn't matter that it should be like a very wow resume. What matters is if it reflects you what you are,
Right.
and you are honest. Be honest. That is what I would say. Be honest, and I think you should be good.
Amazing. Thank you so much, Arwa, for finding out time to pass the torch in this competitive battle. I'll see you again. That's the wrap. I hope this helps. Bye bye, guys.
Bye bye, guys. Thank you, Lina.
Thank you.